Good morning, Mr. Jones. Are you ready to go back home? I wanted to take a minute before you leave to talk to you about the new medication your doctor has prescribed for you. So, as you know, you have high levels of cholesterol in your blood, and we have been trying to manage that. And I know you've previously tried changing your diet and exercise to help lower those levels, and those were both excellent changes. But even with both of them, your cholesterol levels are still pretty high. And that's why your doctor has prescribed rosuvastatin or Crestor. So I know we've been telling you that you need to get your cholesterol levels down. You need to get your cholesterol levels down, and probably have heard that cholesterol is bad. Um, but actually, we do need cholesterol in our bodies, and it helps us make hormones in all of our cell membranes. So cholesterol is necessary, but too much can be very dangerous. And your levels are very high, so we are very concerned about them. So a buildup of cholesterol or a lot of cholesterol in your blood can cause plaques in your blood vessels that make it harder for blood to travel through them, which is very, very scary because that means that our body and our tissues aren't getting the necessary blood um, that they require. And so this condition is called atherosclerosis, which is just plaque buildup in your blood vessels, which is occluding or blocking that blood travel. So again, Mr. Jones, you've told me that you're an active smoker, and this is of concern because the chemicals in the cigarettes cause damage to your endothelial walls, or the walls of the lining of your blood vessels. And so this damage, it occurs in your blood vessels, and so your blood with your high cholesterol is going through these blood vessels, and cholesterol just loves to stick to those damaged spots. And so since you have damage from the smoke, your cholesterol levels are going to start sticking. And so when they start sticking, they're going to group up in a big plaque, and it's going to block off part of that artery. And so we are very concerned about this. And so these those are the reasons why we are concerned about the high cholesterol levels in your blood, and we want to lower those levels so you can stay safe and avoid those conditions. So again, we've talked about you quitting smoking and how that would be a very beneficial lifestyle modification for you. So again, if you're interested, we will always be here to offer resources and help. So just consider rosuvastatin is the drug that you've been prescribed, and it's a HMG-CoA reductase inhibitor. So that's a big word. But essentially what that means is the HMG-CoA reductase is a little enzyme that's in your liver, and it makes cholesterol. I know. So the cholesterol levels that we've been checking, about 25% of that comes from your diet, and the other 75% is made by your liver. So again, diet changes are great and can be very effective, but when the liver is misbehaving and making just an excessive amount of cholesterol, which is what we see here, that's what's making up the bulk of the cholesterol in your body, and that's the big inhibitor. And so basically all this is saying is that rosuvastatin is going to block or inhibit that HMG-CoA reductase enzyme. So your liver is going to stop making cholesterol in order for your cholesterol levels in your blood to lower. So does all of this make sense? So before I tell you and get into the nitty-gritty about the side effects of rosuvastatin, I wanted to ask, are you on any medications that have a risk of myopathy or rhabdomyolysis currently? And if you're not certain, I can go into your medications and check. All right, perfect. So there are a couple side effects for rosuvastatin that I would like you to be aware of. There's a risk of myopathy or muscle weakness, rhabdomyolysis, which is muscle breakdown that can damage kidneys, and there is a risk of acute kidney failure, liver damage, and some GI discomfort. Now, I know that's a lot, and these side effects are rare, but I do want you to be aware. And it is very important, it's imperative that if you experience any cramping or muscle pain when taking rosuvastatin, that you contact your provider immediately. That's something that we do need to check, and treat. So while you're on that medication, we will be drawing some labs to monitor your liver function, because we are targeting that HMG-CoA, which is right in your liver. So typically this medication takes around 2 weeks till we start seeing its effects. So we'll have you come back around that time to check your liver levels and make sure your blood cholesterol levels are low, or lower. This medication works best if you take it at night. A little fun fact is the liver is most active at night, so that's when we're going to take it. I would recommend taking this medication with dinner to avoid upsetting your stomach. So, and rosuvastatin will be in a pill form, so just take it by mouth at least one time a day with dinner. And again, I know this was a lot of information, but if you could just tell me what symptoms that you're going to watch out for and when to take the medication. Perfect, thank you. So I hope you have a great rest of your day, Mr. Jones. Make sure to consider stopping smoking, and reach out to us if we can help, if there's any way we can help you, or if you have any questions about your medications. All right, see you soon.